Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is how to implement trauma-informed care, an introduction, and will be presented by Elise Suna. And now, let me tell you about today's presenter. Elise is a licensed psychotherapist located in Miami, Florida. She is an expert on trauma and trauma-informed care. She has trained over 500 healthcare workers, teachers, counselors, and other practitioners on trauma-informed practices. Additionally, she helps individuals and couples in her practice who are experiencing anxiety, depression, relationship concerns, and recovery from trauma.
And so some of our learning objectives today, we're going to recognize the impact of trauma and the principles of trauma-informed care. We're going to learn strategies to implement trauma-informed care practices with clients, patients, and/or students. So it applies to a lot of different aspects. It's not just meant for clinicians. And we're also going to apply methods of how to mitigate secondary traumatization and promote resilience within your organization or your university. And all of these things are important. And you may notice as we go through that some of them seem like common sense. And that's good. That means that we've already implemented a lot of those practices, but this will be a chance to really see the research that's behind it and why we should be mindful of these certain things that we're doing when we interact with students, when we interact with patients or clients. And you'll see as I talk about this, a little bit about my background. I'm a licensed therapist in private practice, and I work a lot with adults who have experienced trauma, either as a childhood trauma or trauma through their adulthood. So that'll be a lot of the lens I look at trauma, and we'll look at trauma together, but also how then we can implement it within an organization and how that applies. So that's what we'll be doing together today. I think it's important to differentiate between kind of a traditional and what was trauma-informed, because there may be ways we do things in a traditional way, and just we can shift them just slightly to make them trauma-informed. So in a traditional environment, challenging behaviors are the result of individual deficits. What's wrong with you? Versus in trauma-informed, challenging behaviors may be ways of coping with traumatic experiences. What's happened to you? So understanding that. We want to understand that for a traditional environment, you only understand that difficult behaviors as purposeful and personal. And you may take it personally if a student doesn't respond well or isn't engaged. But it's also understanding from a trauma-informed perspective that difficult behaviors may be automatic responses to stress. I think of the very classic example of someone walks into a new environment and goes up to this, let's say a front desk or someone, and just is stressed, is anxious. There may appear to that person as rude, but they may be overwhelmed by the environment. They may have just had something happen to them. It could just be a result of stress. As we sum this up, we went through a lot of different things, and I think it's a successful day if you took just one new thing or it just made you rethink something you've been doing. If that's a successful day that we talked about trauma. Maybe you're thinking about your own experiences with trauma, wondering if you're burnt out. Being mindful of these things is so important to prevention and to checking in with yourself to make sure, do I need some support? Do I need some help? How can we be more trauma informed? Can we do this just a little bit differently? So as we went through this, we know that trauma can impact everyone. Let's just be safe and assume that everyone has experienced some form of trauma. It's more likely than not that they have. And it's quite possible you're listening to this and you've experienced some form. And everyone copes with trauma differently. And so it's important to have policies and procedures in place to mitigate potential re-traumatization and also empower them. Also, most important, all these responses are normal reactions, again, to abnormal circumstances. There's a way we cope and get through things. So we want to make sure we understand that and also are forgiving when things don't go quite the way we intend. We know that burnout, compassion fatigue, and secondary trauma are incredibly common. And we know that self-care practices are very important, and it must be a top-down process. This doesn't just come from the individual. This needs to be approached throughout. So all of these things are what trauma-informed care is, what it means to be trauma-informed, and how we can make just little shifts each day to make sure we're understanding and including trauma survivors, we're including their voices, we're including ourselves, and we're making those changes bit by bit. And this is an ongoing practice of not just a one-time training. This is an ongoing thing that needs to be continued. And it's fantastic that we're starting here.
And I invite you to review our content offerings regularly, as we are continually adding new courses and webinars in various areas of research, ethics, compliance, safety, and professional development throughout the year.